Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Institute for Global Health's Facebook page. We invite you to continue to submit your questions via Facebook at NU Institute for Global Health or directly via email by emailing globalhealthinstitute@northwestern.edu. Leading the discussion again today is Katie Berg, an intern this summer with the Institute. And Katie, I now turn it over to you.
Much for joining us for another segment of Ask Dr. Murphy. Again, thank you, Dr. Murphy, so much for being here and answering our submitted questions. We really appreciate it. And thank you all for joining again and continuing to submit questions. We're going to start again with some recent headlines. First, about masking mandates. What can you tell us about the new masking recommendations for schools this fall?
Yeah, that's the big story of the day. Came out yesterday. First of all, the CDC came out with their guidance recently that said students, anybody who's unvaccinated should be wearing a mask and socially distancing at school, whereas teachers and staff who are vaccinated don't have to wear masks or socially distance. So basically the same kind of rules everywhere that exist, no matter what situation you're in. So the American Academy of Pediatrics released yesterday a very different kind of recommendation. They think the messaging is confusing, it's mixed, and is not going to be helpful. And they are recommending that all schools, every person vaccinated or not, should be masked and practice social distancing for the time being. Now, that would likely change once a vaccine is approved, actually for children, and then they're most likely going to recommend that everybody get vaccinated. But for right now, that's a big difference because the CDC guidelines also say, besides that the vaccinated don't have to wear masks, they say that local school districts, basically they can do really whatever they want. They don't even have to practice the guidelines, and that it's really up to the school district to determine whether they're going to follow them or not. This is a bad mixed message, I think, because that oftentimes will end up being a political decision rather than a medical decision. So I stand with the American Academy of Pediatrics, and I applaud them for coming forward with such a straightforward and strong recommendation. Remember, we are still in a pandemic and we're having a big spike right now.
Right. And that certainly is a very different recommendation than we'd heard. But speaking of schools, still on that topic, what have you heard about legal rulings regarding vaccine mandates in schools?
For universities in particular, they are one by one starting to mandate that all students coming this fall have to be vaccinated. So that's already made it up to the Supreme Court, and the schools won. This should be of no surprise to anybody. They already have mandated vaccines for getting into college already. Many schools require hepatitis B vaccination. Hospitals require flu vaccination every year with all their employees. The Supreme Court already held up that hospitals can mandate that all their employees have the vaccine. So this should be really no surprise. I think it's very encouraging, and let's just move forward and everybody get their vaccine and be safe on campus.
Mm-hmm. Right, definitely a ruling in the same vein that we've seen. Mm-hmm. And lastly, we saw comments from the White House recently. Are there any updates on the reopening of the United States borders or countries bordering us?
Well, the Canadians are opening the border if you're vaccinated. And this is basically just a start that the borders are going to open if you're vaccinated. They're not going to open if you're unvaccinated. They're not going to let unvaccinated people in any of these countries, really is the bottom line, or very few countries. They're also going to require you get tested before you cross the border.
Mm-hmm. Right. Well, that's good news for people that are looking to travel and are vaccinated. Right. Mm-hmm. But now moving on to some of our submitted COVID questions. Our first comes from a viewer who is vaccinated and has implored her family friends to also get vaccinated. They caught COVID in March and have since fully recovered, but have been feeling some extra protection, or almost like they're, totally protected from COVID with their antibodies. But one of their children, who is also unvaccinated, is getting married in a few months. And the question submitter was wondering what the risks for the vaccinated versus unvaccinated guests who may or may not have had COVID as well?
Well, the answer is really the same in all these situations. The fully vaccinated people, 2 doses and 2 weeks after the second dose, basically, they're not going to get very sick. They're not going to end up in the hospital. They're not going to die from COVID. And even if they get COVID, it's very unlikely that they're going to transmit this infection. The unvaccinated people, including the people who already had COVID, are still at high risk for getting COVID. COVID again, in the case of the ones that already were sick, and new COVID for the ones that never had been sick before. So the risk is always with the unvaccinated group.
Right. So look to get your vaccine for your best chance of protection.
Yeah. And then the other caveat to that is that if somebody is there who is vaccinated, but they're immunocompromised, they're taking steroids, they have an organ transplant, something like that, those people are not really probably optimally protected by the vaccine, and they could get sick and could get very sick. So we don't want them getting exposed to these unvaccinated people who then get sick. So that's another reason to try to keep either those people out of the event or to limit the events to everybody who's vaccinated.
Right. That's a great idea. And our second question is sort of similar, starting in the same vein, but a viewer who had their second dose of the Pfizer vaccine in April came down with a very bad cold for 2 weeks in June. And they tested negative for COVID. I'm not exactly sure when they tested, but could it be that they were exposed to COVID or a variant such as Delta and only presented milder symptoms because they have been vaccinated?
No, this is a good question because it brings up how effective are the tests. Now, if they did a PCR test, they did not have COVID. I mean, that test is so good. If they had an antigen test, one of those rapid antigen tests, if they only had one of those tests, the results are not that reliable because those tests are only positive just before you get your symptoms and the first few days after you have your symptoms. Now, if you had multiple antigen tests, like what's recommended, that's as good as getting the PCR because it just depends when you turn positive. So it depends what kind of test they have. Let's assume they had a good test. Then, there's lots of other things that cause colds. We're seeing increase in respiratory syncytial virus. We're going to see influenza soon, rhinovirus, the other viruses that cause colds. So there's other things that cause these symptoms besides coronavirus.
Right. And specifically, if there's not a lot of COVID in your area, it's likely that you have something else as well.
Right.
Great. And another family that's going on vacation is taking extra precaution because their adult daughter is pregnant. And they're worried because most of the family received the 2-dose vaccine, but their son received the 1-dose Johnson & Johnson. And they also have a 2.5-year-old granddaughter who obviously cannot yet be vaccinated. And they were wondering if they should be concerned about when their son joins them on the trip with the rise of the Delta variant and going into public, like eating at restaurants and such.
So there's a couple points in this question. Number one is the pregnant person should get vaccinated.
I believe they are.
And thousands of women who are pregnant have gotten these vaccines. It is definitely safe. Most of the people in those studies, I think there was like over 4,000 people, were at all different stages of pregnancy. Very early stage, mid, and late stage. No problem with the vaccine because COVID is bad if you're pregnant. So the pregnant person should be vaccinated. As far as what vaccine their other family members got, doesn't really make any difference. Johnson & Johnson, Pfizer, Moderna does not make any difference. The little ringer in this story here is that there's also a kid who's under 12 years of age who is not vaccinated. But if that probably is not going to be much of a problem because the parents are vaccinated, presumably, and so that risk it's real, but it's low.
Good to know. Good to know. And so a lot of travel plans that were in the balance this week, and another viewer was wondering with the rise of the Delta variant and the high transmission, if receiving a third Pfizer shot is a good idea or even possible for those in a high-risk group.
Well, right now, it's formally not recommended in the United States. They're doing it in Israel, they're doing it in France, I'm sure they're doing it in other countries. Pfizer has applied for permission to give a third shot to these immunocompromised patients. The data are pretty clear. These immunocompromised patients do respond to a third dose. So it adds to the response already. So typically what happens in an immunocompromised patient, they have either no response with antibodies, because that's the only thing we're measuring here. They have a blunted response, or they have a regular response. So the blunted responses actually do great with one of these booster shots, and the ones that had no response, really severely immunosuppressed, quite a few of them actually will get a response. And maybe they need 4 or 5 doses, who knows? That really remains to be seen. But right now, it's not approved. They have applied. I would expect emergency use authorization approval for a third shot very soon. It's a good idea.
Yeah, right. And from another immunocompromised patient, they are a pancreatic cancer patient considered cancer-free under surveillance. And they have been running periodic temperatures for an unknown reason, and have also had elevated liver enzymes in that time period. I know this is a very specific case, but do you know if it's safe for them to get the COVID vaccine with their intermittent fevers and enzyme?
Well, the issue, this is a real clinical issue that has to be dealt with the oncologist taking care of this person. They got to figure out why this person's having a fever, why their liver tests are elevated and abnormal. That takes precedence over getting the vaccine, because you're going to get the vaccine, you're likely for a couple days anyway, have a fever, they have cancer, maybe it's not that well controlled as they think. They got to figure out what's causing this fever, and then they should take the vaccine. Quickly a decision between the oncologist and them. If it's just a chronic fever from underlying tumor, and that fever is not going to go away or whatever, I mean, the doctor may say, go ahead and get the vaccine. Vaccine isn't going to hurt them, but it may complicate the evaluation of determining what the fever is. So they need to get that work done.
Right, right. And another more general question from another cancer patient, also considered cancer-free under surveillance, but is hesitant to get the vaccine due to worries about their cancer returning. But are there any reasons to think that the vaccine could be risky for them? And are there any studies showing negative effects like these on cancer patients?
No. Solid tumor patients actually do great. Matter of fact, most of the patients who are mildly immunocompromised or have chronic diseases do quite well with the vaccine. They've given, over 160 million doses of these vaccines, and all sorts of people with underlying diseases, and really no problem.
I know there was some hesitancy because there were no cancer patients in the clinical trials, but like you said, millions of people have now been vaccinated and we've not seen problems.
Right.
Right, great. Our next question comes from a 65-year-old viewer who had COVID last November and has still unfortunately not regained their sense of smell and taste. Will they ever get their senses back, and should they seek additional help from a doctor?
Well, they could seek additional help. It's such an unusual side effect with these kind of infections. Generally, that sense does come back, but in case like this, it can be many months.
Yeah, it is difficult. And another viewer was concerned about their 7-year-old daughter, who of course does not yet qualify for a vaccine in the United States, and was wondering if she does contract COVID, what is the likelihood of her getting serious side effects or some of the more long-lasting side effects?
So kids actually have very, very mild symptoms to COVID in general. The serious side effect of COVID and hospitalization rate and this inflammatory reaction that can occur in a small number of children, is really low. It's way less than 1%. I mean, it's like 0.001% or something like that. It's very, very rare. I mean, it can happen, but it doesn't occur that often. So it's interesting that these kids can tolerate the disease better. However, they still get the disease. Some of them do get sick, and the big thing is they can transmit it. And we don't know the long-term consequences yet. Kids that have this mild disease, does anything happen to them years from now? That's why the American Academy of Pediatrics is so strong in their opinion here.
Right. And it definitely does call for drastic action to protect potentially a whole generation from long-term side effects.
Yep.
So next, a viewer who received the second dose of the Pfizer vaccine in mid-April experienced side effects, including severe pain in the injection arm. Specifically, he is arthritic in that area, but he took a leave after getting his second dose to help subside the pain in the arm, and it did work. But he was wondering if taking an NSAID, such as a leave, would result in the vaccine potentially providing lower efficacy than it should.
Yeah, this is all theoretical risk that taking anti-inflammatories are going to block the immune response to the vaccine. So it's generally recommended not to take aspirin, ibuprofen, any of the non-steroidal anti-inflammatories before your vaccination, and as long as possible, a day or two after you've had the vaccine. Take other things for pain like acetaminophen or Tylenol, something else that doesn't have a non-steroidal in it, but if you have to take the non-steroidal, you take the non-steroidal. You have to take it. Probably not going to impact significantly after you've had the vaccine.
Right. So after is the name of the game. In this
it's better than after is better than before. Before is not a good idea.
Okay. And next we have a Delta variant question. Viewers are wondering why the Delta variant is easier to transmit and whether or not it was premature for the CDC to let vaccinated people go unmasked when children cannot be vaccinated and when we have not reached herd immunity.
Well, this is a very philosophical question and a very good question that we really don't know what the answer is. What's happened is, and why we're having this big rise in cases now, it's all being driven by the unvaccinated who are not wearing the masks and are just behaving like everybody else who is vaccinated. That is really what the problem is. People are not following the guideline. You go out in the street now, it's like less than a few percent of people are wearing masks anymore. And we know already that, about a third of the people are not vaccinated at all here in Illinois anyway. So, there's something is wrong here, and that's what's driving the infection now. So, this is like a macro level question that, maybe the guidelines were loosened up too quickly. And, until we could, maybe hit a higher target in the vaccination rate. It's a great question. We don't have the answer to it. But whatever happened is, we're having another big uptick in cases right now.
Mm-hmm. And lastly, we have viewers wondering about the Novavax vaccine. So in your opinion, do you think we could see the Novavax vaccine in the US? And what makes it different from the mRNA vaccines that are already approved?
It's different. The Novavax vaccine is a protein plus adjuvant vaccine, subunit particle protein. It's a completely different technology than what's out there already, definitely from the mRNA and the adenovirus vector vaccines. So, we haven't seen all the data on the efficacy. The preliminary data was that it's about 90% or so effective. So it fits in with the other ones. The other vaccines that have been taken out of development have all had activity 50% or less. So the Novavax they're in the running. They've filed their EUA and they're waiting to hear about approval, which really could be at any time.
Wow, that's great news. And thank you, Dr. Murphy, so much for answering all of these submitted questions. We really appreciate your time and your knowledge. And thank you to all of the viewers who continually submit questions. We really appreciate it, love answering those. So please don't hesitate to submit more, and we'll see you in the next segment.